Hello, my name is Ryan Hood, and I am presenting my PDSA assignment on electronic communication. For PDSA cycle, the Affordable Care Act, which was signed into law in 2010, requires health plans to begin adopting and implementing rules for the secure, confidential, electronic exchange of health information. Using electronic health records will reduce paperwork and administrative burdens, cut costs, reduce medical errors, and more importantly, improve quality of care. This is according to Health and Human Services, published last year. My hospital, Laguna Honda Hospital, is currently transitioning from a paper-based to an electronic medical record system. According to our documents, the transition and expansion of the electronic medical record shall be systematically planned and managed administratively, financially, organizationally, and culturally, published by the San Francisco Department of Public Health of last year. Primary peer-reviewed reports support the premise that meaningful use of electronic health records improve quality of care. This was from a research done by researchers in 2011. The expected quality variance. The expected performance standard is that nurses will use the new electronic medical record system to communicate information on new patient admissions and new infections requiring antibiotics every shift. Evidence of quality variance exists when there is no electronic entry for a new patient admission or an infection for a given nurse's shift. Analysis of this quality variance, in contrast to the expected performance standard, reveals the potential for better quality care through further education and training of the staff regarding the use of electronic medical records. The stakeholders are patients who want better care, nurses, the care team, nursing informatics employees who want a system that they can use to better provide quality care. Then there's the electronic medical record software supplier who wants to sell the most expensive software. Then there's nurse managers, nurse supervisors, and nurse directors who want to buy the least expensive software. And then there's the taxpayers, the San Francisco Department of Public Health, Medi-Cal, and Medicare who want the greatest value for their purchase. The root cause analysis is that the nursing informatics team at Laguna Honda Hospital set up a training program in which they went to 1 unit per shift per day to train the nurses how to use the new electronic medical records. The team did not have usernames and passwords ready for the nurses as they were trained, and by the time they became available, many nurses forgot how to use the new electronic system. Also, many nurses were not on shift when the team came to their unit and thus were not trained. And the nurses on the acute care unit, my unit, were not trained because the acute care unit remains a paper charting only unit. So the problem source is that not all of the nurses are adequately trained or prepared to use the electronic medical record system, especially the nurses in acute care. The solution. The following guidelines will be used by the Laguna Honda Information Systems Steering Committee. The transition and expansion of the electronic medical records EMR shall be systematically planned and managed administratively, financially, organizationally, and culturally. This is according to our documents published last year. According to primary peer-reviewed reports, success in implementing electronic health records includes planning for a period of decreased productivity during initial go-live, gave employees extra time for patient care and documentation, according to research by Dawn in 2012. Another solution is to have advocates for the new EMR who are perceived as leaders by other staff and have them discuss the benefits of EMR to their colleagues, according to research by Byrne and Fine in 2011. So my solution is to get usernames and passwords for the nurses on the acute care ward and have the nursing informatics team train the nurses on how to use the EMR, just in case the nurses are floated to another unit and have a patient who is a new admission or have a patient with an infection that requires antibiotics. My improvement goal is that the acute care unit nurses will have EMR usernames and passwords and will use the EMR system to chart on patients who are new admissions or have an infection that requires antibiotics when the nurses are floated to other wards. My solution implementation is to advocate for the new EMR system by discussing the benefits to my colleagues as my colleagues perceive me as a leader. This is week 1. Inform the acute care nurse manager of the need for usernames and passwords in nursing informatics training for the acute care nurses. That was week 2. Then schedule one training session for each of the 4 acute care RNs on week 3. I should mention that all of these things have come to pass, and all of the acute care unit RNs are now properly trained on the new EMR system. Now, the acute care nurses will be able to demonstrate logging in and appropriately documenting new admissions and infections requiring antibiotics by Monday, August 8th, 2016. I selected that date because that's when our 2 acute care patients are currently scheduled to be discharged, and with no scheduled admissions, it is likely that the acute care unit will be temporarily closed and the acute unit nurses will be floated to other units until an acute admission arrives. Reflection on the participation of the stakeholders. So far, the patients are not participating because they have nothing to do with the implementation or the electronic charting. The nurses, the care team, and the nursing informatics employees are participating. The software vendor did in fact sell us the cheapest program available because the nurse managers, supervisors, and director purchased the cheapest software available. And the taxpayers have funded the purchase. Analysis of the effect of the solution will have on their workflow. 0 effect thus far if the acute unit gets an admission and stays open, which happened. Positive effect if the acute unit closes and nurses are floated to other units that use EMR. It should be noted that I was floated yesterday and did use the new EMR system. The nurse analysis. The nurse leader will ask the other acute care nurses if they were floated to another unit and what patient assignment they had 5 times per week during change of shift report. The nurse leader will then access the Laguna Honda electronic medical records software and check to see if his colleague's patient's assignment included a new admission or a patient with an infection requiring antibiotics. The nurse leader will then check to see if any of the above-mentioned patients had a progress note entered correctly by his acute care nursing colleagues. If the nurse leader finds that all newly admitted patients and all patients with infections requiring antibiotics have progress notes entered correctly by his acute care nurse colleagues for the entire shift they worked, then the nurse leader will find that the goal of 100% compliance with the expected performance standard has been achieved. If analysis of the effectiveness of the change reveals that the performance standard of the nurses using the new electronic medical record system to communicate information on new patient admissions and new infections requiring antibiotics every shift has been met, then the measures that will be taken are described as congratulating the nurses and encouraging them to continue with their excellence in care. The solution will be continued, the gains held, by reminding the acute unit nurses of the need for EHR charting when we are floated to different units. If the goals are not met, then the nurse leader will ask the acute nurse who did not chart the relevant information in the EHR why the charting was not done and provide instructive and emotional support to the nurse to try and do better next time. Since I was floated yesterday and I did correctly use the EMR, I'm going to now congratulate myself and encourage myself to continue with the excellence in care. For reference, we have Electronic Medical Records, A Path Forward, published in Frontiers of Health Service Management, published in 2011. We have Electronic Health Records and Quality of Diabetes Care from the New England Journal of Medicine, published in September 2011. We have Implementation of an Electronic Medical Record and a Health System, Lessons Learned, published in Journal of Nurses and Staff Development, 2012. We have the Laguna Honda Hospital Policy and Procedures, Section 2105, Medical Records Documentation, pages 1 through 7, from the San Francisco Department of Public Health, published in 2015. And then finally, we have Key Features of the Affordable Care Act by year, which was published by the United States Department of Health and Human Services in 2015. Thank you very much.